Hello you guys, it's Dr. Vidal and we are back with Tuesday Tips after a short break as I was on vacation, but I'm back fully energized and ready for another Tuesday Tips. We discuss different topics in plastic surgery and I get to answer your questions, and today we have a very special topic because everyone having surgery should see this video. We're going to talk about pre-op safety measures, what things we do before the surgery to be as safe as possible and decrease our complication rates as much as possible, okay? Very important. And this starts from before you even choose what surgeon you're gonna go with, okay? Because choosing your surgeon is the first step in deciding and prioritizing your safety, okay? Two things are extremely important when you're choosing a surgeon. One is the verification of the board certification. Why is that important? I am a double board certified plastic surgeon, and what does that mean? That means that I'm certified by the American Board of Surgery and by the American Board of Plastic Surgery, okay? So in the United States, we have different boards, and we talk about board certification, but I wanted to discuss a little bit what it means. Board certification is that surgeon or that doctor went through a certified training, accredited in an accredited facility, had examinations throughout their journey and in their education, and then graduated with completing all that certification, right? After that, you graduate from that residency program, fellowship, and whatever it is in your specialty, then you have to go through certain examinations to get your board certification. Each specialty is different. And for example, the general surgery one, which is the American Board of Surgery, requires 5 years of general surgery residency that you do after you complete your medical school. And then you take a written and an oral examination. That's when I got my board certification in general surgery or the American Board of Surgery. After that, then I went to a fellowship or a training program in plastic surgery specifically for 3 years. So it's accredited by the ACGME, which is the entity that accredits residency programs in the United States. And after completing that residency program in plastic surgery and completing all the requirements to that, which involves thousands of cases in all the specialties of plastic surgery, that's when you can sit down for your written exam. The written examination verifies your knowledge, right? That's the one that checks that you met all the boxes and that you know your material. But the oral examination in plastic surgery is different from any other specialty because it not only for general surgery, it's just cases that the surgeons ask you about, and you have to give your knowledge on those cases and, very importantly, your judgment and your safety criteria. But for plastic surgery, it's not made up. You have to collect your cases for an entire year, submit your entire cases to the board. They evaluate all the cases that you did for those two things, right? Safety and judgment. And then they choose 5 of those cases, and you have to send all the information on those. Pictures, your pre-op evaluation, your notes, your operative. So it's a very extensive and rigorous process. You submit all of this and then you sit in front of them and they ask you each and every question regarding each case. So it's a very comprehensive examination that it's not done in any other board certification, but especially in any other board certification in cosmetic surgery. It is specifically for plastic surgery. So when you're choosing a plastic surgeon, you want a surgeon that has gone through that rigorous process, that for him or for her, safety and judgment is key and priority to put that into your surgery and to your outcome, okay? So board certification matters, and it's very important that your surgeon is board certified, and it is important that even if he or she is board certified in plastic surgery, works in an accredited facility, and that the facility standards are up par to what that surgeon believes, which is safety and judgment, okay? So here at Pure, we are certified by the highest accreditation, which is JCAHO, the Joint Commission of Health and Hospitals. So it's the same accreditation process for hospitals. So that's the level of scrutiny and importance that we have here in an office-based facility, but approved and accredited by JCAHO, okay? So very important to ask these two questions when choosing a surgeon. So now you chose your surgeon, and I'm gonna go into details of what I require for my patients, right? This part is for the patient to decide. You're choosing your surgeon, now you chose a surgeon, and now I go through this process with every single patient to optimize your safety and make sure that your complications are as low as possible. It's never zero in surgery, but we try to make it as low as possible. So number one is the pre-op clearance process, okay? So I got your evaluation, evaluated your pictures, made sure that you're a good candidate for the surgery that you're interested in, but now I have to make sure that your health is optimal to withhold and to tolerate that surgery, okay? So the pre-op clearance is different things that I ask. These few things are different time frames, but more or less in the 2 months before your surgery, so everything is up to date and close to your surgery date. One, it's blood work, okay? So what is the blood work that I ask for is a CBC. With that one, we're checking your white count, your hemoglobin, hematocrit, and platelet count. All of that is important, very, very important, especially if you're having liposuction. Number two is a chemistry panel. So with that, I'm checking your electrolytes, kidney function, sugar levels. Also, I order a coagulation panel, PT, PTT, INR, so making sure that your blood makes clots adequately so you don't bleed extensively during your surgery. Also, it is important that if you have other medical conditions, I am going to ask for blood work specific for that. So for example, if you have diabetes, I have to check a hemoglobin A1C. That tells me your blood sugar level in the last 3 months, okay? So that needs to be less than 6.5. If you have thyroid issues, hypothyroidism, hyperthyroidism, I have to check your TSH, T3, T4 to make sure that it's within normal range, okay? Controlled with your medication, and so on and so forth. Another blood work that I order for all my patients is HIV, okay? If you're HIV positive, we can do your surgery if you're controlled, but it's important to know for a infection control point, okay, in the operating room, and the things that we need to do to make sure that that's well established and controlled. Other blood work that I do for female patients, it's the pregnancy test, okay? So it's important that it's negative before proceeding. EKG for every patient. You're going under general anesthesia. We have to check that there are no arrhythmias and that your heart is good and strong, okay? PCP or your primary care physician needs to write a medical clearance note, okay? Tell me, I'm young, I did all the blood work, everything is negative, why do I need a PCP to see me? Well, I'm a surgeon. I need your medical doctor to check that everything is okay and make sure that all your conditions are well controlled before you're coming into Miami or before you're coming in for your surgery, okay? So PCP clearance is very important, okay? Chest x-ray if you're over 40 years old because of the anesthesia, we have to make sure that your lungs are healthy. If you're having a breast procedure and you're over 40, I'm gonna ask for a mammogram and breast ultrasound to make sure there are no masses or lesions in your breasts. And if you have any medical conditions, I may ask for a specialist also clearance, okay? Example, if you have thyroid issues, I may ask for an endocrinologist. If you have any cardiac issues, high blood pressure, if you're over 45, I may ask for a cardiology clearance on top of your medical clearance from your primary care physician, okay? All of that is cleared, we're good to go. So how do we prepare now for surgery day? Everything is great, your hemoglobin is good, all the labs are good, medical clearance is on. It's important to start some supplements, okay? Surgery is a big stressor, And especially for liposuction, the blood loss may be high. So we need to even optimize a little bit more of that hemoglobin and get you to a very healthy state, because you're gonna lose blood. Every surgery has some blood loss. So we need to kind of pump you up a little bit more, so when you take the hit of surgery, you're back to normal, okay? Or you can tolerate it more. So the supplements that I'm gonna ask you to start, it's iron, folic acid, and vitamin C. Iron and folic acid increases directly your hemoglobin level. Vitamin C helps with wound healing, okay? So these 3 supplements, at least 30 days before your surgery, you should start them. And I'm gonna ask you to continue them for the following 2 weeks after surgery to get that extra bump in your hemoglobin and your healing process, okay? And you start some supplements, but you stop some things too, okay? It's very important to stop things that are gonna affect your healing and your recovery. Number 1, and most importantly, nicotine, okay? Nicotine affects small blood vessels. It's not gonna let you heal, and it's gonna also affect your general anesthesia because your lungs are gonna be affected. So nicotine is the one, it's extremely important to stop at least 30 days before your surgery so you can clear your body and have everything out of your system before your surgery. Stimulants such as like Adderall, amphetamines, energy drinks, all of that, get it out of your system, okay? This affects your heart rate, okay? So you want all this out so you can be ready for your anesthesia and your recovery. Estrogen is important to stop at 30 days before your surgery because it increases risk of blood clots, okay? And that is a big no for surgery. We want to decrease all the blood clot risks, especially after a tummy tuck mommy makeover, but after any surgery under general anesthesia. And the other thing that you're gonna stop is, like, you just told me that I'm gonna start supplements. Yes, but you're gonna start this supplements and stop any other supplements or herbal vitamins, any like that you are currently taking. Why? Vitamins and herbal supplements are not FDA cleared or approved, which means that we don't know exactly what they contain. The problem with majority of herbal supplements, multivitamins, is they have components that increases risk of bleeding. For example, garlic, okay? For example, bromelain. All of these things increases risk of bleeding and is not safe before your surgery. So it is safer to stop everything that you're taking, start the supplements that I am advising you to increase your healing and your recovery without affecting bleeding or any other complications, okay? All of this is before the surgery. And you may ask, what do I do now during and after surgery? We'll talk about that next week in detail because it's a lot of information for only one live. But I'll take some questions now if you guys have it.
Yes, and all related to the topic. That's
Awesome.
a good thing.
Awesome. I like it.
What does your hemoglobin need to be before surgery?
Very good question. So your hemoglobin needs to be above 11. 11 is my lower limit, but I advise everyone to be above 12. If your hemoglobin is between 11 and 12, there are a few things that I'm going to recommend. One of them is I am definitely gonna do a cell saver on you if you're doing liposuction. That cell saver is a machine that I pass everything that I'm taking out of your body, that fluid that I'm removing. It filters it out, removes all the components that are plasma, fat, and just leaves the blood cells in, and I replace that like an auto transfusion. So the total blood loss of the surgery is less. The other thing that I'm going to ask you, again, the supplements to start, and also I would recommend if you're having liposuction to do Vaser liposuction. A Vaser liposuction, it's an ultrasound mediated liposuction, which breaks the fat but also decreases blood loss, okay? So if you have a low hemoglobin to start, very, very important to consider adding Vaser lipo.
This is not a question, but it's a nice message. I choose you. See you in a few weeks. Sandra.
Thank you, Sandra. I'll see you very soon. Hope this is helping.
Yeah. And here West say she's amazing. I'm so thankful for my results.
Awesome. Thank you so much. I'm very happy for you.
Okay, and let's go here on Instagram. Can I take Hemaplex and Thoradix at the same time?
Yes, so that's a very common question that I get. Both of them have different doses, so it's safe to take it both.
I got vitamin C with rose hips. Is this the correct one?
So write us through Clara to know specifically the one that you are taking. I always recommend to have it clear vitamin C because some of that supplements, like I mentioned, not FDA approved. We don't really know the other components that they have, and not only the other components, but the dosages of them, okay? So just send us a message to Claire. I'll take a look and I'll let you know.
What dosage in iron?
So the iron dose is the Hemaplex and Floradex combined. Again, send us a message and we'll send you the specific amounts.
So you today for my pre-op, and I'm so excited.
That's awesome. I'll see you tomorrow. Get ready.
I just popping in to say I feel so good and I look so good being 4.5 months post-op.
That's great. Very happy for you. Send me pictures. I want to see.
And well, this is, you already say, but did she say what's the required hemoglobin levels?
So yes, let's do it again. And I'll write it here. A hemoglobin needs to be above 11. Better that it's above 12.
Yay!
Awesome. So thank you so much, you guys. Hopefully this helps kind of understand a little bit of the process and the reason why this is so important. And tune in next Tuesday and I'll be talking about the intra-op, so things that I do during the surgery to increase safety, and the post-op measures, okay? Have a good week and I'll see you next Tuesday in Tuesday Tips. Take care.